In our studio right now is Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Now, if you've been listening throughout the morning and talking a lot about the Kyrie Irving trade, there's a part of this that kind of relates to sports medicine a little bit, and that's where I want to start with Dr. Joe here, and that's Isaiah Thomas. If you remember in the playoffs last year against the Cavaliers, he was pulled out for the rest of the season with a bad hip. They said they were shutting him down. Did he ever have surgery on this thing, Joe?
Well, as you know, I get what I get just reading through reports and everything else, and read them pretty carefully. They sounded like they got some surgical opinions and some non-operative, what we call conservative opinions. He went the conservative route, did not have surgery, rested for a period of time, rehabilitated. And in fact, last night, almost every source that reported on the blockbuster trade talked about the fact the Cavs team staff really wanted to get their hands on him and see how the hip was coming and everything. But there's no question, an important sidebar to last night's story about the trade is going to be, will Isaiah Thomas be ready to go opening night? There was some inference from Danny Ainge throughout the period of time. He may not be ready for for practice opening week. He may miss the beginning of the season. Brad Stevens didn't go quite as far, but said, we don't know what we have with the hip. So there is some sport medicine intrigue in the blockbuster from last night as well.
And he's smaller, and he takes quite a bop, and he plays reckless. You just worry about that on down the line.
Yeah, they never said exactly what it was, but I'm thinking probably in our day and age of hips, possibly what we call internal derangement, something torn. It's often to be the labrum, and many people can play with this small cartilage tear called the labrum in the hip. Some people get it fixed. So the fact that it was up for debate, and he saw a couple of opinions, if you remember last year for the series, and then even after the series he saw a few opinions. That's what I'm thinking. It probably something in that range of hip problems, and other things are possible too. But anyway, there will be something to watch in the intrigue from the blockbuster, and that is Isaiah Thomas's hip.
Okay, let's go to baseball coming out of last night. We got two guys going on the DL. Andrew Miller returning. Danny Salazar returning, both to the DL. Let's start with our big lefty weapon, Andrew Miller.
Yeah, when my friends say, gosh, in sports, a lot of times it all comes down to the sports medicine teams. Sometimes it does. When you look at the Tribe right now as a Cleveland baseball fan, Ray, and you are one, I know, this team has a legitimate chance to win our first championship since 1948. Legitimate chance. The pitching staffs were lining up, both the starting staff and the relievers. Without Andrew Miller, do you think that chance drops off significantly? This is a really big deal. What happened the other night? Oh my gosh, that really hurts from a sports medicine standpoint. So patellar tendonitis, everybody's talking about what that is. Yeah. It's an overuse injury. That's the majority of my practice, overuse, overload. I see kids with this, and high school kids and college kids all the time with patellar tendonitis. It's called jumper's knee. It happens most in basketball. It happens a lot in volleyball. It does happen in other sports. But this strong tendon below the knee, the patellar tendon, gets overloaded, and it gets a series of micro tears. So you can play through it, but with these micro tears over time, it will, if you continue to play, heal in with scar tissue. And after a period of weeks or months, that shock-absorbing tendon that's really important, like the Achilles tendon, like in the shoulder, the rotator cuff tendon, that tendon doesn't absorb shock anymore. Athletes come in and say, I feel a sense of giving way in my knee. Some people say, is that an ACL? They're giving way. No, this is a different kind of giving way in the knee. And Andrew Miller's knee gave way with his landing foot. The foot that he lands with, the right knee, gave way the other day when he came off the mound. You could see it. You could see him kind of grab at it. You could see him walk straight over and say to the trainer, come on out right now. Not good news for us. So that patellar tendon didn't heal with the first go of treatment. And the first go of treatment for an overuse injury, rest. That's what they're emphasizing in the paper. But physical therapy, and we do things to get the blood flow going in the tendon again. There's a very specific strengthening program that we do. The opposite of bulking a muscle, we actually do what's called eccentric training. We do deep tissue massage. We do ultrasound stim, a whole bunch of things that physical therapists do. But the first swing at getting Andrew Miller's knee better with that amount of time and everything else didn't get the knee totally better. So we've got about 6 weeks to get him better. And now the question is, do you go to the second level of treatment? And there's other things we do in the second level of treatment, most notably There are injections, particularly of this PRP is probably being discussed somewhere here, where they take out your own blood, inject it into the tendon to try to regenerate that tendon quickly to get it to absorb shock again. So those and other things, second-level treatment, are probably being discussed. But really, they have about 6 weeks to get Andrew Miller's knee better.
Without you being inside the folders of his medical
That's
condition,
right.
I mean, can you speculate and say that he could be back for the playoffs?
Oh, it's so variable with overuse injuries. Obviously, a week ago, they thought he was ready with just a couple of weeks of rest and rehab. And this is going to be a week-to-week variable thing, seeing how he does. You saw, and I was really surprised, Tony and I were talking before, they actually went across Gateway to the Cavs because they talk about patellar tendonitis. 60% of NBA players have some degree of patellar tendonitis. So it's very, very common when you play high-level basketball. And to talk about what might be that next level of treatment. Surgery not really in the mix, but what might be in that next level of physical therapy, injections, and other things that they may be doing with Andrew Miller. All hands on deck to get him ready for October 1st.
Okay, this hamstring for Jason Kipnis, we're now 3 times into this. Hobbles off the field last night. And I know there's all sorts of variables with hamstring, from just tweaking it to the tear and type of thing. Hamstring, you need this in athletics in every sport, especially when you're looking to drive a baseball.
Oh, yeah. I mean, you know, Ray, that it's the biggest, fleshiest, strongest muscle that we use a lot in sport. And so when it's not right with a deep injury to it, it takes a long time. Just go across, again, Cleveland sports to Corey Coleman. I mean, he was struggling with this when he was in college, continued in his first year with the Browns, and they say that there's some, sometimes the remainder of your career because of some of the scar tissue that forms around that hamstring tendon. So it was, I had to, I'm sorry, but I had to chuckle a little when they were saying what they told Kipnis, don't run all out when he came back the first few weeks. Did you hear that discussion of things? So he's going down the line trying to leg out a hit. How are you going to not go all out? And baseball is a go from a dead stop to a full start and sprint or lateral movement. If you're making a play at second base, do you want him not going all out? He's got to go all out in October. There's no doubt about it. And so I would have to say, in Jason Kipnis's case, I think it's very unlikely that he won't at least go into the playoffs with some degree of disability. I mean, with the hamstring bothering him some. How much, I don't know. Full court press of trying to get him ready for October as well. But there are a lot of injury question marks surrounding our featherheads of the Cleveland Indians.
Great stuff this morning, Joe. Thanks for taking time to come in.
Thanks, Ray.
There you go. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital.